Welcome to the JEMS Report, brought to you by Clarendon Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. My name is Ted Lee, and I am the editor-in-chief of JEMS Magazine, along with Jeff Frankel, our managing editor. We are bringing you subject matter experts and industry leaders in all things pre-hospital medicine. And today, in accordance with Heart Month, we have Jonathan Epstein from the American Red Cross to talk about what the Red Cross is working on. So thank you for joining me today.
Yeah, it's great to be here, Ted. We're really excited to talk about, one, obviously February being Heart Month, but really what Red Cross is working on in resuscitation. So glad to be here.
So why don't we start off with, give us a little bit about your background, in this space, and then of course transition into the Red Cross.
So yeah, fantastic. So my background from a Red Cross perspective, I lead our healthcare product management team. So I'm responsible for our EMS, public safety, and hospital-based resuscitation programs. So when we think of, kind of Heart Month and what we're doing around resuscitation education, it's a really exciting time, I think, for the Red Cross, but also for the industry in general. There's a real focus on looking at the education around resuscitation and really broadening out options for EMS. So we're really excited of what we're working on right now and actually what we just released as well.
Well, of course, cardiac arrest is always a big issue, and you can see the gray. I've been in it for a little bit, and it's always been a benchmark for providers about how well you do CPR. And this is, kind of your resuscitation efforts are always, under the microscope on how we're doing things. But it's more than just the providers, and the Red Cross getting out there into the public. And doing, a more community-based focus sometimes is pretty interesting. So what are you guys doing more so, or maybe start with the history of and then moving into, how much the educational component of the Red Cross really started to become important?
Yeah, and I'm trying not to date or age myself as well, or data age the Red Cross. But if you think of life-saving education, the Red Cross has over 100 years in the drowning, water safety, and first aid space in education. And certainly over the last many decades, the Red Cross has had a wonderful footprint in training both the community as well as public safety and healthcare professionals in CPR. I think as we look kind of toward the last 5 to 8 years, the Red Cross made a concerted effort not just to have, really our award-winning community-based first aid CPR AD education, but also the introduction of our resuscitation suite back in 2019, where we really brought a new generation of education with basic life support, advanced life support, and PALS, pediatric advanced life support, to made it available for an EMS community as well as hospitals. So a real focus in that kind of public safety space. But going back to what we're doing in the community, I think it's exciting, but it's also something that's really needed is around what we call our Mission CPR project. And Mission CPR, working with the folks from CARES and the CARES registry and using the data, we are beginning a process where we're actually, and targeting is not a great word, but we're really looking at specific communities around the country where there's low bystander CPR rates today. And we're trying to infuse lessons, infuse training and education with a lot of partners, including, again, CARES and Resuscitation Academy and others, to bring that more both traditional, conventional CPR training, but also even hands-only CPR training really to the communities and the people that really need to understand how to do CPR in those first few moments. I think, as a paramedic, as a first responder, we understand, that time is critical, but those immediate responders, the family member, the coworker, that may just know enough to push hard and fast and have that willingness to push hard and fast is so critical. So really our Mission CPR program, which is tailored after a drowning prevention program that's had great success in over 100 communities now, is a really exciting new initiative that the Red Cross is working on again today. I think with the healthcare and the introduction of the resuscitation suite, about 5-6 years ago now, we have over 4 million healthcare providers and EMS providers that are actually certified by the Red Cross, which a lot of people don't understand or realize that the Red Cross has a full complement of educational programs built on solid foundational evidence. Our programs are built on the International Liaison Committee on Resuscitation, so ILCOR, Consensus of Science and Treatment recommendations, the same recommendations that are used by all the resuscitation organizations throughout the world. We have a robust scientific advisory council that guides our program development as well. So we really have multiple evidence-based and scientific review layers really advising and helping us build our products, and not just from a clinical perspective, but also from an educational perspective. Really making sure that we are focused, whether it be in the community space or in the healthcare space, that willingness to provide care, that stickiness of the education, trying to make things simpler and easier to follow and remember, driving what we all want are better patient outcomes.
Yeah. I mean, I remember back in the day, the kind of the understanding with the Red Cross is that it was more community facing, less health professional facing. I mean, my initial interactions with the Red Cross was a lifeguard course and a basic first aid type course early on in my end of high school into the military career. So it's interesting to see the focus shift a little bit more to where it's a little bit more well-rounded and more inclusive. So how do you think that inclusion kind of works towards the chain of survival of first response, awareness, telecommunicators being involved with instructions for CPR, when the first call comes out, and then of course the first responders arriving after dispatch?
Yeah, I mean, when you think of, whether the adult or the pediatric chain of survival, I mean, we're really trying to focus on each element of that chain, again, from that bystander community, kind of point of entry into the system, that 911 caller with dispatcher-assisted telecommunicator CPR, working all the way up through, post-resuscitation care in an academic medical center. So really, from a Red Cross perspective, we're trying to look at the entire chain, if we want to kind of think of it that way, but really make sure we have the right educational offerings that really speak to each of the learner types and the personas of those learners, so that we are looking at continuing to broaden out our EMS specific educational offerings. I think the latest evidence of that is we released a brand new curricula just a few weeks ago that is related to neonatal resuscitation. So our new Neonatal Advanced Life Support program, we're calling NALS for short, is really focused specifically on solving a problem that's a national problem. So when we think of EMS and we think about where babies are being born in this country today, and I don't have a map to show you, but when we look at data from the March of Dimes, we know that 32% of the counties in this country have no maternity care services available to them, which means there's no hospital that has a labor and delivery suite or a level 1, 2, 3, or 4 NICU to care for a newborn. So when we think about where babies are being born, we really wanted to focus on the EMS aspect of that program. So the program will cover labor and delivery and NICU and certainly in hospital environments, but also a big focus on the emergency department and birthing centers and EMS, even with a specific EMS track in that program. So when we think of kind of that chain of survival overall and that contextualization, that focus on what does a learner need contextually to where they work is really kind of the hallmark of what we are working on at the Red Cross. And I think more broadly, as we're building our next generation of resuscitation programs, so our BLS, our ALS, and PALS programs, what we'll see come later this year when the new guidelines release will be specific EMS tracks. But also, we have specifically called out EMS in a lot of our curriculum to allow providers to practice as they perform. So instead of taking a course where it's very rigid and you must, follow this protocol and this lesson plan and cannot deviate or add a local protocol, and then you take that course, you get a credential, and then now forget what you learned. Now let's teach it over here, what we want you to do. We're incorporating, we're closing that gap. We're allowing and bringing that ability to take your local protocol with medical oversight and certainly some scientific guardrails around it. So there's devil in the detail, but we are allowing EMS agencies with medical director approval to incorporate local protocol into those practice and scenarios so that can practice with the equipment that you use, practice your protocols based on what your local jurisdiction, your local organization wants of you, or your state, if it's a statewide treatment protocol as an example. So it's a real nod to that contextual learning. It makes it stickier. It's more efficient. It's certainly appreciated. I'm actually at a fire academy of all places today, kind of snuck out of a class where we're testing some of our new curriculum right now. And really, the feedback that we're getting, and as a head of product, feedback is a gift. But the feedback we're getting is that ability to incorporate what we're doing locally into the learning is made such a difference for them from an outcomes perspective.
Yeah. Yeah. I can always remember the classes, the mandatory classes that you have to do, to recertify, and you'll go through and, you're memorizing medications or you're memorizing techniques, and you're like, but we don't necessarily do that here. We don't carry that medication, or we don't have that procedure. Or if it was a hospital involvement, and you're like, we don't have that service in this county. We never deliver to a hospital that has that capability. So I can see where this would be a little bit more realistic, kind of, train as you do the job, instead of, flicking on a switch. Oh, this is just specifically for this course and nothing else.
Right. And yet, again, being a national organization, and with the U.S. military training network utilizes Red Cross, a lot of large healthcare systems and EMS agencies that use Red Cross. People move around. We understand providers work from one service to another. So certainly understanding of building a curriculum and building educational products that allow people to take that certification, that course completion, and be portable with it, we have to ensure the right guardrails. So cognitively, everyone's aware of what those scientific standards are, what those treatment recommendations are from ILCOR and working down through the Red Cross guidelines, but also that you have to contextualize it locally to what your protocol is. And I think that's really the sweet spot of why we've been so successful in growing the Red Cross resuscitation programs, but also it's allowing us now to do more and more mission work. So as people understand the Red Cross is in healthcare, and we are working with EMS and working with fire-based agencies on a lot of different mission-based programs, it's really kind of tying everything really nicely together. I think, Ted, you talked earlier about, you thought of the Red Cross going, well, lifeguard and first aid back in high school. I did a presentation many years ago to the Eagles physician group, and I asked them, my first question I asked when I went in and had that meeting, I asked them, so how many of you started your career with the Red Cross? And none of them kind of could answer the question. They kind of looked at me kind of funny. I said, okay, let's go backwards. How many of you were lifeguards or CPR instructor when you were in high school? Every hand in the room raised. So, and they thought about it, a lot of EMS professionals, a lot of healthcare professionals actually start with those lifeguarding courses, those first aid CPR courses, those babysitting courses, even early on in their middle school and high school years. And it actually sparks that desire to kind of get into public safety and healthcare. It was really striking when you think about where the Red Cross was, and then now that we have, we are well embedded into healthcare today. It's really satisfying for me in my role here. I served as a regional EMS director in Massachusetts for many, many years. I've done some other work in other EMS organizations, but being at the Red Cross, it's really come home to me of kind of where I started my career. And be able to create education specifically for this market and specifically for EMS, kind of built by paramedics for paramedics and built EMTs for EMTs, as well as obviously the hospital side. It's really, really satisfying. And we hope we know the science is right and the education is just superior.
Yeah. So you mentioned this suite package kind of came into creation in 2019. Could you give us a little bit of a background on what drove that kind of interest and why? Because obviously it's not something that an organization can do lightly. You can't do it at the snap of a finger. It's something that takes a lot of work and resources to bring this up to speed. So kind of where did this come from, and what was the the initial focus?
Yeah, I think there's a couple impetuses of the resuscitation suite in its birth. And I was actually a member of the Red Cross Scientific Advisory Council for about 14 years before I joined the Red Cross as a staff person many, many years ago. But in that realm, really back, if you go back to 2013, 2014, the Red Cross became very interested in broadening our ability to reach the learners in healthcare and in EMS specifically. So we actually built the resuscitation suite, as we call it today, we actually built a BLS course specifically for EMS back in that kind of 2015, 2016 timeframe. It released as kind of our first foray of separating kind of the lifeguarding focused CPR for the professional rescuer program and more to a course specifically for that EMS and healthcare environment. It really well received, and that was kind of a launching point for us to start focusing on broader healthcare. And I think there were some needs, certainly from the military's perspective, and some of our work with the military, and a lot of stars aligned with our relationship with HealthStream from a hospital perspective, and working in the hospital markets of really kind of coming together and building, really a flexible, cost-effective system for, again, hospitals and for EMS markets. So if you think about our delivery options, through one organization, the Red Cross, instructor-led programs, we have blended learning with an instructor, blended learning with a self-directed mannequin, review or challenge-based courses. We really wanted to speak and offer flexibility and really top-notch just relationship management and customer service to really make sure that we are there for ultimately our customers. I mean, our job is to improve outcomes. So how do we help you as an organization was a real focus. So all the stars aligned in that kind of 2018, 2019 timeframe to us to bring those programs to market. And and it wasn't easy. As you talked about, a lot of resources, a lot of time, but really a lot of commitment from Red Cross leadership and leadership of others. Leadership with the military and the Uniformed Services University helping us pilot and develop the programs, and taking a lot of feedback. As a product person today, feedback's a gift, and we take feedback very, very seriously, and we want to hear the good, bad, and the ugly. And we took a lot of feedback in that 2018, 2019 timeframe to really get the courses right, make them more enjoyable, make them more engaging, but also make sure they're right medically and they're correct educationally. And that's where kind of the Scientific Advisory Council for the Red Cross, our SAC Education Sub-Council, comes from, really helping guide us what's the latest and best from an education perspective. So a lot of stars aligned, a lot of commitment from a lot of people. And I was just happy to help be part of that process. And we're seeing great results today.
So we're about 6 years-ish from the creation of the suite. And you mentioned, starting with EMS, CPR, basic first aid type courses, advanced cardiac life support, pediatric, and now into the neonate or newborn suite. Was this kind of the idea from the beginning, or was it well, let's get this building block done and then we'll reevaluate whether we're going to move forward with advanced cardiac life support or move into the PALS or the neonate area?
Yeah, there was always a desire, I think, back even before, I was a Scientific Advisory Council member and volunteer to kind of move into this space and offer some of our expertise around education and around medical science as well. Being the International Federation of Red Cross is now a collaborating member of ILCOR, and it took a lot of work to get there. But the science and making sure that what we're delivering to the public, whether it be, again, lay responder, bystander level programs, the workforce and workplaces, all the way through healthcare and EMS, they're certainly a driving force. So I think when we looked at the suite, ALS, BLS, basic life support, ALS, so we call it ALS, not ACLS, because it's not just cardiac anymore. So we kind of took that C out of the name intentionally, because we're talking about sepsis, and we're talking about stroke, and we're talking about other really rapid response team and code team kind of issues and kind of those life-threatening resuscitations that are not just cardiac related. So BLS, ALS, and PALS, I think that was always thought to kind of build those together, because from a business perspective, not that I love to talk about the business side of the world, but in order for us to be able to deliver educational content, whether it be just basic life support, you need to have a suite of products together. And really what we've done now is kind of make that suite whole. We wanted to make sure we covered all the requirements, all the programming, everything that we can deliver one suite of products. So it looks the same, feels the same, it's administered the same. It's one set of instructor rules and requirements. So you don't have to go between multiple vendors. It was really essential that we kind of put all these together. So I think the neonatal was twofold. One, we were missing that link, that last piece of a suite that really our customers were asking for. And the broader one was this EMS, we're seeing in EMS, the challenge is the maternity care deserts. There are a lot of EMS agencies that just didn't have access to neonatal resuscitation at all. They didn't, emergency departments even didn't have it. We were at NAMSP conference a few weeks ago, and we actually piloted, because it was pre-launch, we piloted two of our stations of our neonatal course there. And we had some of our leading EMS physicians and EMS educators in those pre-conference workshops, and getting to use a 00 blade on a 28-week preemie mannequin, but to practice those skills for really what could be a once-in-a-lifetime experience. We know these babies, and this challenge is over 500,000 births a year are affected by these deserts, and over 5 million women are affected by these maternity care deserts. We want to make sure that EMS and critical access hospitals, small community hospitals, and EDs have the same level of training and education, but understanding the limitations of what equipment they have, what their scope of practice may be, and incorporate a training program for them was really a driving force of the NALS program. Again, it covers everything that we would see in a tertiary care NICU, and delivery suite as well. But really the driving force of NALS is, one, let's complete the suite so we have a complete option for services and for EMS agencies as well as hospitals, but also we're trying to help solve what is a national crisis around this maternity care issue.
So you mentioned that you were testing out some of the aspects at ACEP in January. So when is this coming fully online? When can providers start seeing this and start contacting their local Red Cross chapters to try to get some of this training?
Yeah, so actually it was at NAMSP in January. But at NAMSP, we were 3 weeks before launch. So at the very end of January, the entire course released. So it's actually in market today. So if you think about it, it was 2 days before Heart Month. The very end of January, we kind of brought into market. We birthed our new program of Neonatal Advanced Life Support. And when we're starting to see already, we have a cadre of existing instructors that teach the neonatal resuscitation program, have bridged over to the Red Cross process, and are just beginning to get ready to start teaching the course itself. So we'll be doing some specific targeted EMS program development courses starting in kind of first week of March, and then another one in April and May in different parts of the country. So if people are really interested in it, the best is to go to redcross.org and then go to our on the website to our training page around our resuscitation suite. And that's where they get all the information about BLS, ALS, PALS, and now NALS, about how to bridge to be an instructor. And we make it really, really easy. Our instructor materials, there's no cost to become a Red Cross instructor from a standpoint if you're coming over with other credentials. Our materials for instructors are all free and digital. We're trying not to put a burden on the instructor side or the agency side. So we're trying to ensure that these programs, and certainly the new NALS programs, it's accessible and readily available. But it's a new program, Ted. It will take some time to the instructor. So we're going to rely on a lot of our hospital partners and a lot of our nursing partners that have already been teaching similar programs to deliver these first series of programs over the next several months as the program gets underway. But early reviews for the program, we had a lot of naysayers in the marketplace. And we built this program with another organization. We built it with AWON, which is the Association of Women's Obstetric and Neonatal and neonatal nurses. So it has kind of both a Red Cross and AWON perspective to it. But we had a lot of naysayers like, well, why are we doing this? And we had some naysayers come back and have taken the program already, and they've come back with glowing reviews, absolutely glowing reviews about the stickiness, the easy way that the course works. It doesn't read like a textbook. It's a blended learning program, so the online environment's tracked for an EMS separate track, a hospital separate track. They can really pick their track and really understand coming into that in-person hands-on skill stations what they need to do. They find it superior, and the educational tools, the instructor tools that are built for it, it's world-class, and it's really the direction we'll go, and we're going with our next generation of our BLS, ALS, and PALS programs, which are due to release in the fall when the guidelines are released from ILCOR and the co-stars from ILCOR in October.
Okay, October, great. All right, well, we're about at time and wrapping up. Is there any closing message you would like to give the audience? I mean, this is great information, and it's very interesting to see that, the NOWS course is kind of the next block in the block of courses, and definitely something that's critically needed.
Yeah, I think in closing, I think from a Red Cross perspective, our goal, our mission, and our drive is to improve patient outcome. With everything that we do, we're certainly ensuring that we have the right evidence, the right science to back all of our programs. We want to, continue to get the word out that Red Cross is in healthcare and is in EMS and has a very strong EMS focus. And that's even from our mission programs. I didn't talk about our Sound the Alarm campaign, where we work with fire services around smoke detector installations around the country. Obviously, all our disaster support that we're working on. But certainly, again, feedback is a gift. So if anyone has feedback for us, has information want to share or ideas, we welcome it to hear from the EMS community on how else can we help serve you. Our job is to help solve some problems and identify what those problems are, and then create solutions that make sense.
Oh, great. Well, I wanted to thank you again for joining me, taking time out of your busy day. Like you mentioned, you're in training, with a group right now. So I really appreciate you taking the time to speak with us. And we're looking forward to more information and the new guidelines coming out from the Red Cross.
Fantastic. Nice meeting you, Ted.